I'm Megan, one of the spine nurses here at WashU, and we've put together this series of videos to help prepare patients for their upcoming spine surgery. In this video, we're going to be talking about pain management and coping techniques that could be useful for patients that are undergoing spine surgery. So, why think about coping and pain management strategies before surgery? Well, having spine surgery is a big deal. It has potentially long recovery with lots of restrictions afterwards. Anxiety and depression are common in our patients both before and after surgery, and this can worsen pain and play into the way that patients process pain. Patients often tell us that they feel unprepared to cope, that they're afraid, that they catastrophize, they make things worse than they are. And so we want to help prevent that. And then coping skills take time to develop. This video does give you these strategies so that you can start to implement them. You can get used to trying some of them. You can become familiar. And hopefully, by the time you have your surgery, you're going to be more familiar with them. So, the first thing I want to do is I want to talk about pain. It's one of the most common questions that I get asked by our patients. How bad is the pain going to be? Am I going to be in a lot of pain? What are we going to do to manage the pain? So it's an important topic for spine surgery patients. The definition of pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage. And the reason that I want to bring this up is that there are a couple things that are especially important in here. And one is it's not only a sensory experience, it's not just feeling the pain, it's also how we process that emotionally. And that can be very challenging for people. We know that chronic pain can sometimes change the neurochemicals in the brain, and can impact the way that we do everything. So it's important to acknowledge and to realize that there is an emotional component to pain. The other thing, too, is that I want to point out that it's associated with actual or potential tissue damage. Pain does not always mean that something is quote unquote wrong. Especially in the setting of a surgery. You've already had the trauma. The body does not understand the difference between what we did to you in a spine surgery and you being in a motor vehicle accident. It knows the tissue was damaged and it hurts. But that doesn't mean that there's always something wrong or that having continued pain means that there's further tissue damage happening. The body has to heal that up. So there is going to be some pain experienced, and you just need to understand that that's kind of a normal part of the healing process, and that there are ways to cope with that, but it doesn't mean that something is wrong. So one thing to be aware of, pain may temporarily be worse or different after surgery because of the trauma that happens to the tissues during the surgery. So the pain that you had before surgery may be better, but now you've got different pain from having had the operation. It may be the same as what it was before and just be worse. It may be exactly the same. So there's a lot of different ways that patients experience pain after surgery. And again, just because it's different doesn't mean that there is something wrong. It's important that you discuss realistic expectations with the surgeon and their staff, because as I mentioned in the last slide, sometimes patients feel unprepared for what they experience. So having realistic expectations and knowing, yeah, this is not going to be fun, but you can get through it is helpful. And then we do recommend limiting or eliminating narcotic usage prior to surgery. What we know is that the more narcotic pain medication you're on prior to surgery, the more difficulty we have controlling the pain after surgery, because your body does become used to those narcotics, and your pain response system will not be the same as what it was if you were off narcotics. So talk to your surgeon's office about that. We always want you to use the correct medication for the pain that you're actually in. So not all medications need an opioid or need, Tylenol. Sometimes muscle pain or nerve pain aren't going to respond to those things. So it's important to have the right medication for the pain that you're experiencing. Heat, ice, massage, acupuncture, exercise, all of those things can help decrease the amount of pain that patients have. So looking at alternative treatment options besides the narcotics are going to help you decrease those. And then again, talking to your surgeon's office and getting their advice in terms of stopping medications like anti-inflammatories, NSAIDs, or opiate medications is important. The other big thing we want to talk about is anxiety and depression. So, anxiety and depression are really common both before and after surgery. Sometimes patients that have never had anxiety or depression beforehand can develop that after surgery itself. So, we want to make sure that that's being addressed for you. So, anxiety and depression can affect chronic pain and disability, and they can be affected by chronic pain and disability. It kind of is a bit of a cycle there. It can also impact patient outcomes in their perception of their recovery and can have an impact just on the way that they are processing everything that's happening to them. So it's important to speak to your primary care doctor, to a counselor, or a psychiatrist if you have a history of anxiety and depression so that we can make a plan with them to take care of you after surgery because those conditions do need to be managed um, outside of your surgeon's office. So let's talk a little bit about coping techniques and pain management. So, pain medications, it's important to remember that the goal is to reduce the pain, not necessarily to eliminate it. The pain medications are not going to take away all of the discomfort that you experience after surgery, and probably even before surgery. So, we want the pain to be tolerable, but the goal is not necessarily to eliminate it. We want to use the least amount of medication possible for adequate pain relief. So, not necessarily taking 2 pills just because you can. If your pain is well controlled on one, then we need to use the least amount that we can. And the timing as well. If it's 4 hours when your pain meds can be due, but you don't need it, wait another half hour, wait an hour and see if you need it then. Don't take it if you don't need it. Again, we want to use the correct medication for the type of discomfort. So, this is something that we see a lot that well meaning physicians will put patients on narcotics, and the pain that they're having is not necessarily the type of pain that responds well to that. So, nerve pain that radiates into the arms or the legs, that's a shooting and a burning, maybe is not the best type of pain to be treated with narcotics. Same with muscle spasms and muscle tightness, grabbing, pulling, tightness. Those things typically respond better to a muscle relaxant. So sometimes using other medications, what we call adjuvant pain medications, can actually help better with your symptoms and reduce the amount of narcotics that you're taking. We want to wean and reduce the strongest medications first. So again, those are going to be the narcotics, the opioids, things like hydrocodone, oxycodone, fentanyl, tramadol, all of those medications that are the kind of the stronger pain medicine, we want to make sure that we're getting off of those first. And again, you need to discuss concerns with your surgeon and their staff because they're going to be able to help guide you. Nobody's interested in making your pain worse than what it was, but we want to make sure that we're giving you the best care and that we're doing everything we can to keep you out of pain, but also being mindful of some of the problems with these medications. Anxiety and depression. Again, these are medications that will be managed outside of your surgeon's office. So it's really important to discuss these with your primary care doctor, and it's important to take them as ordered. You do not want to stop these medications cold turkey unless you're told to do so by your doctor. All of these medications can be continued for surgery and can be used afterwards as well. Make sure that all of your doctors know everything that you're taking because some medications that can be used for pain could potentially interact with some of those antidepressants or anti anxiety medications. And then there are some antidepressants that also do help with pain. So sometimes patients will talk to their primary care doctor about switching over to those medications, typically duloxetine, amitriptyline. Again, talk to your primary care doctor or your surgeon about your pain control and work together with everybody on that. So, some non medication coping techniques. What can we do outside of medications to help patients deal with pain and to deal with the anxiety, the depression, the stress of having had surgery? The first one is goal setting. So, having a specific and measurable goal that's not a pain rating. So, an example of this would be to be able to walk 1 mile without stopping 3 months after surgery. That has nothing to do with pain. And it's a measurable, achievable goal, and we have a time setting for that. This goal should be personal and important to you. I think it's helpful to share that with your surgeon and the staff. I like it when patients tell me what their goal is because not only do I know it, but in times that are tough, I can remind you, yeah, but you're making progress towards this goal, or this is why we did it. So I think it's helpful to make that personal and to share that with others. And then you should regularly check in on the progress towards that goal. If your goal is to walk 1 mile without stopping, well, am I really working on that goal? And how close am I to making that happen? And what steps do I need to take to get there? Exercise is another important activity that can help with people's discomfort. So patients tend to think of exercise as causing more pain, but actually patients who exercise have less pain than patients who don't. So the endorphins will help to elevate mood, they help with stress, and obviously there's a ton of physical health benefits to exercise as well. Patients who routinely exercise have better sleep than patients who don't, and sleep can be a big problem after surgery. So exercising and sleep go hand in hand. Patients who exercise are going to have a decreased fear of movement. So they're not going to be as afraid to get up and motivate themselves and to be moving. And that's going to improve their surgical outcomes. It's safe before and after surgery with restrictions, especially after surgery. There may be certain exercises or activities your surgeon does not want you to do. So talk to their office, refer to your reading information, just make sure that you're doing the right kind of exercise for the surgery that you've had. And then you want to pace yourself. Take breaks before it hurts. Don't try to push through pain. Be sure to refer to our exercise and physical activity video that we provide along with this one. Um, but you should be exercising, you should be moving. You're going to find it helpful. Guided imagery and meditation. So basically, these things work by kind of following peaceful voice instructions that help you relax your mind and your body. It helps with pain, it helps with anxiety and depression, sleep, fear of movement. Some downsides of it, it can take a little while to feel comfortable learning to meditate and learning to use guided imagery. But it can be done anywhere, can be done at any time. There's no side effects. And it really can help in the moment just to redirect your mind towards a more positive place, to focus on your breathing, really disrupt some of those negative thoughts that patients have after surgery. It can be used in the middle of, a pain flare up. And it's instant change of state, I guess. There are some smartphone apps out there for it. Calm is one app. It is typically a paid app, but there are some free ones on there. Insight Timer and Headspace both have quite a few free guided meditations and guided imageries, and there's a lot more of them. And this, again, is something that takes time to feel comfortable with and to practice, but it really can be helpful for patients. So would recommend looking into some of these apps, kind of starting with it now, and I think you're going to see a lot of benefit in the with this prior to surgery. Music therapy. Music therapy helps with pain, anxiety, depression, sleep, quality of life. All of those things can be improved with music. And so the way that we do this is generally use soothing or calming music, and it needs to be selected by the patient. Don't let somebody else pick your music therapy for you, because it may not have the same relaxing effect on you that your own music would. And then listening to that for 30 minutes or more at a time to focus kind of quietly on the rhythm or the lyrics. For some patients, they may find it to be sensory overload. It's not always appropriate if you're in a public place to be playing your music out loud. Your hospital roommate may not like you very much if you're playing that. So make sure that you have headphones so you can listen to it yourself. But it has a lot of advantages. It's portable. You can do this anywhere. There's really no side effects to it. It's personalized for you because you're going to be the person that's selecting the music. Again, just like guided imagery, it's rapid relief. Focus on the lyrics, focus on the beat and the tempo, and it can be combined with these other modalities to help patients relax and to be a bit of distraction from what's going on with them. Aromatherapy is the use of concentrated scents and oils from plants to help with symptoms. So basically any kind of scent or perfume, essential oils, and it can help with pain, with anxiety and depression, again, sleep and quality of life. So it can be inhaled throughout the room. It can be applied topically or massaged. Um, you should not drink it. I but there's various ways of kind of taking that in. And there's a variety of scents available. And essentially you pick whatever is comforting to you, whatever feels good. Lavender and peppermint have been pretty extensively studied and have been shown to be beneficial for patients, but not everybody likes those scents. So the downsides of it, you may not like the scent that was recommended or that you tried, and it may not be effective for everybody. But it's something that's generally inexpensive that can, really help sometimes with headaches or nausea. It's been studied extensively in those things. Some advantages of it, again, it's portable. You can have a little vial of essential oil in your purse and take a sniff whenever you need to. It can be personalized because, again, picking the scents that work well for you. It's available on demand and it's inexpensive. So it's something that some patients really do benefit from and find very calming. And it's worth giving a try in those moments when either your pain is poorly controlled or you're finding yourself feeling a little down or anxious. Gentle touch. So it's just physical touch and maybe a gentle massage from, a loved one or somebody that you trust. So examples are hand holding, hand or foot massage, stroking of the hair, face, or gentle rubbing of the arms and the legs. None of the surgeries that we're going to do would prohibit you from having gentle touch. We may not want you to have full massage, but these gentle touch techniques can be very helpful and comforting for patients. Some of the downsides, I guess, is that it may not be enjoyable, and it shouldn't be done immediately around the incision. So I would not want you having a massage around the area that was operated on. But in these other areas, light, gentle touch, whatever feels comfortable, it gives a sense of comfort and camaraderie and lets you know that there are people there that are kind of helping. There's no side effects, it's portable, it's personalized, and it can be used with other techniques. Use some of the essential oil massage, can be combined together. Distraction, I'm a huge fan of for our patients. So I do recommend having something to distract you. So whether that's reading or audiobooks, a movie you've been wanting to watch, something you've always wanted to do, like learning a new language, learning to knit, model cars, visiting with family, playing with pets, any of that stuff that's going to take your mind out of the moment and help you focus on something else really does benefit patients in terms of pain, in terms of their depression, or even just being bored. Some patients tell me they're really bored being stuck at home, recovering and not being able to do much. Can also help with mobility and dexterity. So all of those things are important. Some patients tell me, well, I'm still bored watching TV. Well, okay, find something else to do. And it may not work for everybody, but it is something that I find helpful for patients, and patients that have something to do are going to have less pain and less complaints than patients who don't. And then the last recommendation is cognitive behavioral therapy, or really any type of therapy. So, therapy with a counselor and a therapist to develop coping mechanisms, understand the effect of pain on function, and decreasing fear of movement. Um, Patients, I think, tend to underestimate the ability of therapy to help. This is a big deal for most patients. It's a life altering event, at least temporarily. And most patients need some help processing that and kind of having a plan in terms of what to do with their pain, with the frustrations that come along with being restricted. So it's always another option for patients. Downsides, it could be potentially be expensive. It can be inconvenient, and it can be a little bit hard to arrange. But there are now online, especially in COVID pandemic times, there are online therapy services. There are some text-based or phone-based services out there. And the pros, it really can help with every aspect of your surgical planning and your recovery. So if you are overly, if you're concerned about surgery, if you're find that you're kind of overly fixated on it, if you find that there are certain things that you can't get past and you've talked to your surgeon and the staff and your primary care doctor, and you just need some help processing everything, then reach out. It really is a good resource for patients. And then the last thing is to ask for help. The Living Well Center here in the Department of Orthopedics can help with arranging some counseling and can help kind of an integrated technique model. So I do recommend looking at the website ortho.wistal.edu and looking at the Living Well Center and the services that they offer. Your primary care doctor is a good resource for pain management and coping techniques and mechanisms. They are always there to help you. Checking with your insurance for in network providers that may be able to help with therapy services or medications if needed, and then talking to family or friends. And of course, if you are in crisis, especially if you're feeling suicidal or homicidal, there are numbers here. So the National Suicide Prevention Lifeline. And then another thing that we have locally in St. Louis that's a fantastic resource is that there is a behavioral health urgent care run by SSM. They're open every day from 9 a.m. to 7 p.m. And the phone number is there, so you can look that up. And then, of course, if you feel like you're in immediate danger to yourself or anyone else, then you should go to the emergency room and seek emergency treatment. So that's our video today on coping and pain management. I hope that it was helpful. Please always reach out to your surgeon or their staff if you have any questions or concerns. Thanks and have a great day.